Hello, my name is Leslie. I am a UTEP nurse practitioner student. I will be conducting an assessment today. There's two parts of the assessment. One is a head, eyes, ears, nose, and throat, and the other one is a patient health questionnaire. Mr. Ray, are you okay by going with Luis?
Yes, that's fine.
Okay, so I will go ahead and start the assessment. The first part just consists of 9 questions, and this is just for your overall general health and see how we're doing, okay? First question is, do you have any little interest or pleasure in doing things?
No,
Do you feel down, depressed, or hopeless at times?
nope,
Do you have trouble falling or staying asleep, or do you sleep too much?
nope,
Do you feel tired or have little energy?
nope,
Do you ever have poor appetite or are you overeating?
nope,
Okay. Do you ever have feelings of feeling bad for yourself, or that you're a failure, or that you have let someone in your family down?
no,
Trouble concentrating on things such as reading a newspaper or watching television?
no,
Do you move or speak so slow that other people could have noticed?
no, not at all.
Okay. And do you have any thoughts that you would be better off dead or hurting yourself in some way?
No,
Okay, this is part of your chart, so I will keep it in your chart and it goes in there. Okay. We will proceed to the next part of your assessment, which is the second part. Okay, I will start with conducting an interview of the head. Okay, so at this time, I will be inspecting the hair. As I assess the patient, I am looking for quantity, distribution, if there's any lesions, bald spots, and texture. Sometimes hair can be fine or brittle, so we are assessing for that. We move on to the scalp. Again, any masses, scalp, lesions, or, yes, I said bumps. The skull, if there's any depression of the skull, lacerations due to trauma, we are assessing that. Deformities, we want to make sure that the skull is nice and even, which it is. Then we proceed to the skin of the overall head and the face. We are also looking for acne scars, any lesions, bumps, masses, face symmetry on the patient. Luis, can you smile for me, please? As the patient smiles, you are looking for symmetry of the patient bilaterally, that one side of the face doesn't droop or anything like that. We move on to the neck. We are going to assess for cervical lymph nodes. Assessing cervical lymph nodes, you do get 2 fingers and you palpate on the side of the neck. You are checking for any lumps, rigidness, or tenderness of the cervical lymph nodes. You also want to note size and if they're palpable or tender to the patient. At the same time, we are also assessing the trachea, making sure it's midline, there's no lumps, masses next to them, and that the patient is not tender as well there. We then proceed to check trachea sounds. Can you take a deep breath, please? Okay. These trachea sounds are a little harsher and louder than your regular breath sounds, and that is a normal finding when you are assessing the sounds of the trachea. We are also checking for deviation, making sure that the trachea is aligned proportionally. We then head back to the back of the patient, and we ask the patient to flex their head like this, their neck, and we are palpating the thyroid gland here in the center of the neck. We are checking to see if it is enlarged. Luis, can you please swallow for me? At this time, we are checking to see if he has a goiter or anything like that that can prompt us to checking or assessing further for any thyroid problems. We move on to the eyes. We are going to check visual acuity. The way we check visual acuity is using a Snellen chart. So for the purpose of the test, I will have a patient read, pretend that there is a Snellen chart. So Mr. Luis, can you cover your right eye and read line 4?
A, B, C.
Okay, go ahead and proceed with covering your opposite eye and read the same line.
A, B, C.
Okay. For the purpose of this test, the patient was able to read the line. In the event that the patient is unable to read the line, then you proceed to the higher line of the Snellen chart until the patient can see correctly without straining the vision, and that would prompt how the patient's vision is. We also want to check visual fields, which I will be standing 2 feet across from the patient and testing his or assessing his peripheral view. And this is called the wiggle test. So I am going to be diagonal, and I'm going, Mr. Luis, you will need to tell me which fingers I am wiggling. Please just look to the center of me and let me know which fingers I am wiggling.
This one. This one. This one. This one.
Okay, perfect. So that does assess the peripheral vision. Next, we proceed to ocular motor. And by this, we will have the patient follow your finger without moving the patient's head. So the patient will only move the eyes. And the center. As you move to the center, the pupil should constrict, but we will check for pupil constriction in a little bit. As we assess for the eyes, we are looking at color changes. We want to move on to the eyebrows, eyelids, eyelashes, making sure that there's also equal distribution of hair or there's no psoriasis, skin lesions on the eyebrow. To the eyelid, we want to make sure that there's no drooping of the eyelid or there's no excessive exudate, lesions in the eyes, styes, or chiliazon. Sorry, I can't say the word, but I will practice. Or ptosis of the eye. We're also looking for drainage. At this time, we are assessing the iris, the pupil, the sclera, and the conjunctivae. It should be nice and pink. Sometimes in patients with liver issues can have jaundice, and the sclera should also be nice and white. Having a pink or red sclera are also signs of conjunctivitis. Next, we move on to the lacrimal ducts, which are the inner canthus of the eye. We want to make sure that the patient doesn't have dry eye, excessive tearing, or any also exudate from the inner canthus, just meaning that they have duct lacrimal glands. The cornea, when we are looking towards the patient's eye, we are looking for any opacities, which could mean that the patient has cataracts. So we are assessing for that. To assess the eye, we also get our ophthalmoscope. This doesn't have batteries, but for the purpose of the test, I will verbalize. So you do want to change your dial zone to 0. This is the standard, and then you want to make sure that your light on the ophthalmoscope is working. Okay, I will be grabbing the ophthalmoscope with my right eye and checking with my right eye to the patient's right eye. So, sir, I will be checking your eye, Mr. Luis. Okay, and pupils to light should be equal, round, reactive, and accommodate to light. So that's what we are checking for. So I want to move to the left eye, and I'll be grabbing my device with my left hand, checking with my left eye, assessing the patient's left eye. So we're also looking that the pupils are reactive, round, equal, and they accommodate to light. If the patient doesn't have this reaction to light, then it could be that there's a cranial nerve 3 damage, or patient has a prosthetic eye. Upon the fundoscopic exam, we are looking for the red reflex or any opacities that interfere with this reflex. Okay, we're also looking for enlarged vessels, cupping, or papilledema. And that concludes the eye exam. So next we move on to the ears. For the ears, we are going to assess the auricle here. We usually, when we assess, we're checking for any keloids, deformities, any lesions, and making sure that the ears are proportional bilaterally. Once you assess that, you go ahead and palpate. We are testing for external otitis externa, If they are sensitive, that's what you would find. You go next to the tragus, the mastoid. The tragus, being sensitive to the tragus or the mastoid, can be sign of mastoiditis or otitis media. We're also looking for any, upon the otoscopic exam, I'm sorry. We are checking the tympanic membrane. So again, I don't have batteries. You want to grab the auricle, pull up and back. Then we will be checking the tympanic membrane, making sure it's not red. It has a pearly white color to it. It's concave. We don't have any foreign bodies in there. There's no drainage. Patient is not sensitive or having pain. Then we go ahead and check the other ear. Also grab the auricle, pull up and back. And same thing, that's what we're assessing. Make sure that they don't have any perforations. For the purpose of hearing exam, we do conduct a whisper test. So Luis, I will be conducting a whisper test. I will be standing behind you and I will be saying a letter and a number. If you can please verbalize back what I have said, and that will be the hearing exam.
A12. B12.
If the patient were to get part of what you were whispering wrong or didn't hear you, you would repeat the test. If he has unilateral hearing loss, you would conduct the Weber test using a tuning fork. And you would do a Rhines test with the tuning fork as well along the mastoid bone. And then the mastoid bone, moving it to the side of the ear to see if it was air versus bone conduction on that aspect, if the patient does report hearing loss or fails a whisper test. We move on to the nose. We're looking for symmetry, any deformities, tenderness. So you grab your otoscope and you do want to get the scapula and you want to have the patient flex up. And you want to grab your scapula and be careful not to hit the septum, because sometimes the patients can be very sensitive to this area. So you want to shine light and you want to check for the mucosa in there, nasal mucosa. You're also checking for polyps, septum deviation, or any lesions or perforation. Another part of the nose assessment is your frontal and your maxillary sinuses. You want to make sure that they're not tender or full with a lot of pressure. This can be a sign of acute sinusitis. We move on to the throat. We are checking lips, oral mucosa, make sure that they don't have ulcers, tracheosis, chapped lipped, lesions, cyanosis, pallor. We are checking outside. Then I will ask the patient to open. At this time, you are checking the hard palate, soft palate, teeth for any teeth disease, gum disease, swollen gingivae, any ulcers, cavities, discolored teeth, missing teeth, misshapen teeth. On the oral mucosa, that should be it. When you are assessing the pharynx, can you please open your mouth? Say ah. Ah. So when the patient says ah, you are able to assess a couple of things. You are able to assess if they have enlarged tonsils, any exudate on the tonsils, peritonsillar abscess. You want to make sure that they are able to say ah, which means that they have a gag reflex intact, and you are testing for cranial nerve 12, which is your hypoglossal nerve. You are also assessing your tongue, making sure that it's midline and the patient is able to move and protrude the tongue. You're checking the texture of the tongue, making sure that they don't have what is called a hairy tongue, any lesions or masses on the tongue, any exudate, swelling, enlargement, or anything like that. We can also check the vagus nerve, which is your cranial nerve 10, and making sure that it's symmetrical. The uvula is symmetrical. And this would conclude your head, ears, eyes, nose, and throat assessment. Do you have any questions, Luis?
No, you did great.
Okay, thank you.